Teens and young adults are vaping at skyrocketing rates.
A new generation of nicotine users has essentially been created almost overnight.
Spurring Senator Ron Wyden to push legislation in D.C. to tax e-cigarettes the way traditional cigarettes are.
We know that young people are responsive to pricing of nicotine products.
Multnomah County commissioners have been lobbying for a state tax you'll see on your November 2020 ballot that would tax vapes and e-cigarettes. Wednesday, they stood by Wyden's side to send the message, vaping isn't good for you, especially if you're young.
Because the impacts of nicotine on a developing brain are lifelong. And no one really understands that when you're 14 years old.
These devices have never been proven to help people quit smoking, and they have been shown to increase the risk that teens will smoke regular cigarettes later on.
While they're less toxic than cigarettes, county health officials say they still have harmful chemicals.
Most kids vape because the e-liquids come in fruit and candy flavors. They believe these things are safer than they truly are. There are unknown risks from unregulated liquids and by using e-cigarettes to inhale marijuana.
This push for regulation comes as severe vaping-related lung diseases have popped up in 25 states. And as Oregon investigates a middle-aged person's death in July linked to vaping.
The CDC, FDA, and state health departments are all working together to investigate these widespread lung illnesses and study samples. There's a lot of information that's unclear right now, but we set out to verify what we do know to help you better understand the situation. The CDC says all people coming in with reported lung illnesses have reported recently using e-cigarettes. There isn't an exact cause right now, so we can't verify if there's a pattern with a product, chemical, or ingredient. However, all the people getting sick say they're having trouble breathing, they're coughing, they have chest pain. Many are reporting feeling exhausted and even nauseous. So we can verify all individuals coming into the hospitals have lung issues. Now, as many of you know, e-cigarettes and vapes can have nicotine, THC, or CBD. Right now, though, we don't know exactly what is causing people to get so sick. And a lot of information out there right now, patients reporting vaping THC or CBD that they bought off the street. The government came out last week and warned people not to do that, but we can't confirm where the products are coming from. And it's important to note, most of the Americans hospitalized with lung damage are young because that's the age group that uses e-cigarettes the most. But as we saw with the death here in Oregon, adults are prone too. So age doesn't matter. Back to you guys.
Morgan, thank you. Now, if you would like us to verify something, here's how you can get us involved. You can contact us with the email you see on your screen, verify@kgw.com.